I need to go back behind my client. I should have done this while I was back there and do the hearing test.
Okay.
And before you go behind your client, tell her what you're doing. I'm going to whisper very, very softly a couple of words, and you just tell me what they are.
Okay.
Okay? And if you have any difficulty hearing the sounds, let me know.
Okay. Baseball. Ice cream.
Oh, very good. Did you hear those without any difficulty?
Mm-hmm.
Very good. Okay. Now I need you to lay down for me.
Okay. Can I set my glasses over there?
Mm-hmm.
Thank you.
I just want you to squeeze my fingers
Okay.
real tight. Very good. Now pull on my fingers. Now you pull on you. Oh, you're very strong. No difficulty there. Need to get a sheet and cover you. I should have already had a sheet on there. Any problems with your abdomen?
No, ma'am.
When was the last time you had a bowel movement?
Yesterday evening.
And what was it like? Color-wise and consistency?
Light brown.
Was it formed?
It was formed.
Okay, so she had a bowel movement yesterday, light brown form. Do you have any problems with your bowel movements?
Sometimes.
Sometimes, like what?
I don't go like I should.
Okay. You take anything for it?
I eat a lot of fiber and drink a lot of water.
That's good. Okay, now you're going to protect privacy the whole time you're doing this skill, so that's why I've got this sheet here. I'm going to go around the other side so you guys can see what I'm doing. Okay, first I'm going to inspect the abdomen without doing any palpation. I'm looking for any heaves. I'm looking for tattoos or scars. It's a good time if you notice a scar to ask the client if she had surgery. You do have a tiny bruise in the right lower quadrant of your abdomen. What's that from?
An injection for migraine.
Oh, okay, so it was a sub-Q injection. Okay, and she has got a little cosmetic, almost like a ring around her umbilicus, and you would note that. And let's see. I don't see, she's got a little, well, almost like a little birthmark down here on the left side. Okay, I just need you to put your arms up here and then lean forward for me. Okay, I'm just checking to see if she has any protrusion of any of the abdominal wall. Looking for a hernia, and she does not. Okay, next you want to auscultate and listen to the nature of her bowel sounds. If they occur between 5 and 35 seconds, that's considered active bowel sounds. I'm starting the right upper quadrant. Okay. So she's got gurgles about every 10 seconds, which is normal. Okay. And that one was in 3 seconds. It was almost hyperactive. And lastly, listen over the umbilicus for any abnormal pulsation sounds. Okay. Next, you want to palpate. And use one hand to guide the other hand and start in the right upper quadrant. Any tenderness?
No, ma'am.
And you're feeling with the pads of your finger. And don't take your fingers off the abdominal wall or you'll lose your spot. Nice and soft. She doesn't have any tenderness. Note the shape of her abdomen. It's rounded and soft and non-tender upon gentle palpation. You do feel better. That's because I've examined Shelley before. And you come back to where you started. Any discomfort with that at all, ma'am? Okay. And we're going to defer the vaginal pelvic exam, and you all will have a breast to examine, and will they have a vaginal model to examine? No. Yes? Okay. Or testicles? Okay. And you need to, you can demonstrate percuss in one area as long as you don't do it over the bone. Mainly you're looking for sound over the liver. Okay? All right. I'm going to check the strength of your legs, Miss Chandler.
Okay.
So what I need you to do is, I'm going to push my hand, you raise your leg up just a little bit, and I'm going to press down against it. Don't let me push it back down. Very good. Now can you bend your leg up to straighten it? Wonderful. Same thing over here. Good. Now bend your leg up. All right. I want you to press down like you're pressing on a gas pedal. Good. Okay, can you curl your toes up toward your head and don't let me pull it down? Good. Any numbness or discomfort anywhere?
No, ma'am.
Okay. If your patient was on bed rest for some time, you'd want to check for a Holman sign. And what you can do is put your hand just gently under here and see if you feel any heat or any redness that you see. She doesn't have any. Take her foot and gently flex it towards the head of the bed. How's that feel?
Fine.
No discomfort. Okay. Now while you're down here, we're going to pretend her legs are bare. I've got her covered. And just inspect her leg for any swelling, any varicosities, any scars, or any tattoos. And she has none. And her legs are nice and smooth. And you want to check your popliteal pulses bilaterally. We're not going to check the femorals, but you need to know where they are. You want to check the posterior tibialis, which is right back here by your malleolus. And check the dorsalis pedis. And while you're pressing here over this bony area, or even down here around the ankle, you can also check for edema. She has no swelling. So you would just say that she moves all her extremities equally and smoothly on full range of motion in all her joints. She has no edema in her lower extremities. Her peripheral pulses are equal and strong, or if you only check certain ones, and you have to say which ones you checked, and if they're equal and strong. You don't have to rate them on a scale for this skill. Okay. Now, what we're going to do is cover back up her legs. We're going to check her sensory system to see if it's intact. First, you want to have the patient acknowledge what you consider soft, what you consider dull, what you consider sharp. Okay, ma'am, I'm going to check each one of your extremities to make sure that everything is okay as far as your sensation. So I want you to feel this, and that is called soft. Okay? This tip of the paper clip is considered sharp. Okay? And then this blunt side is considered dull. Okay? Now when I actually test you, I want you to close your eyes, because the mind can play tricks on you when you see something, and you see it, you're just going to say, that's sharp, and it registers. So for me to really truly know that your sensations are intact is for you to close your eyes. I want you to tell me the sensation you feel and the location.
Okay.
Okay.
Dull left foot.
Uh-huh.
Sharp right toe.
No.
Is it dull?
Uh-huh.
Dull.
That was dull. Okay.
Okay.
That's okay.
Well, I'm scared to
Yes,
say that.
yes.
Sharp.
Okay. Where at?
Left foot.
Okay.
Oh, sharp right lower leg.
Correct.
Soft left inner leg.
Uh-huh.
Soft outer right leg.
Very good. So your sensation's intact. Keep your eyes closed.
Soft left arm. Soft right hand.
Very good.
Sharp left hand.
Mm-hmm.
Sharp right arm.
Mm-hmm.
Dull left arm. Dull right arm.
Very good. You can open your eyes now. So your sensations are intact. So you could just say that neurologically her sensations are intact and she follows all verbal commands with no difficulty. And you want to check her short-term memory. What were the 2 words I gave you?
Horse and trailer.
Very good. So did you have any problems during the exam?
No, ma'am.
Okay. Well, okay, that was the conclusion of our physical exam. I want to point out that when I was palpating Miss Chandler's lymph nodes, her cervical and her neck, that you do not do it from behind. I did that so you could watch my palpation technique. Just remember to do an overall general survey when you greet your patient. Note their range of motion, note their gait, note their facial features, whether they're symmetrical. Give them 2 words to remember. Do your head exam at the beginning and inspect their hair, their scalp, look in their ears, eyes, nose, and mouth. Do your vision check near and far. Inspect their arm and their hands. Look at their nail beds for capillary refill. Check radial and brachial pulses. Note their skin turgor on their forearm, unless they're elderly, and then you do the sternum. Listen to the chest anteriorly and laterally while you're in the front for their breath sounds, and note their heart sounds at that time and do an apical. Listen to the back posteriorly to the lung fields, and at that time do your whisper test. Do your abdominal assessment, then move to the lower extremities where you will check their leg movement and their strength. You inspect the legs and the feet, noting any edema, varicosities, scars. Check their popliteal pulses bilaterally at the same time, their dorsalis pedis and their posterior tibialis. And then you're going to conclude with a sensory check where you're going to check for dull, sharp, and soft sensations in all 4 extremities, and ask the client, what 2 words did I give you to remember? And that's the end of this.